Hello, everyone. Welcome back to the Nurse Kristen YouTube channel. And for all of you guys that are listening on the podcast, welcome, welcome, welcome. So excited to have you guys here. One of the very first episodes we had for the YouTube and the audio was for my nursing or my pre-nursing students. And then last time was for my nursing students. This week, it's going to be for all of my new grads out there. Yay. All my new grads out there this week, this episode is for you. We are going to be discussing imposter syndrome. I do get a decent amount of DMs from my new grads out there that are just getting their feet wet, just having their first nursing job, coming out of having passed their NCLEX and are now a nurse and working on a unit. But unfortunately, you just have this overwhelming feeling of just feeling very overwhelmed and just feeling like, do I even belong here? So we're going to kind of discuss a little bit about imposter syndrome and just some tips that I have for you guys to help you get through your first job and how to kind of get over that feeling of imposter syndrome, right? So the very first thing we're going to discuss is exactly, Kristen, what is imposter syndrome? If you're not even sure exactly what I mean by that, imposter syndrome is basically feeling like a fraud. So feeling like you don't deserve to be a nurse, or maybe like you're trying to fill steps that you don't feel like you're good enough, right? So like and it doesn't even have to do with nursing. It can be within any other profession in business. If you're like now like a CEO of a business and you worked your way up from being like the very first person all the way to a CEO, when you first have that position, you do kind of feel like a fraud because, you feel like you're trying to be someone that maybe you just don't feel like you're good enough, or, you feel like you're a fraud. You're feeling like you're trying to be something that you don't maybe necessarily feel like is deserving quite yet. It's new ground. It's an uncomfortable feeling. And a lot of that is due to just being inexperienced. A lot of that is just not having the experience yet. And it's just getting your feet wet, hence being a new grad nurse, right? You're just beginning your career. So imposter syndrome, the number one thing, I'm going to have 6 things I'm going to talk to you guys about. The number one thing I want you guys to know is it's very, very normal to feel this way, to feel the imposter syndrome. Everyone goes through it. I went through it whenever I was a new grad. I remember having my very first nursing job, and unfortunately for myself, it was probably during the worst time to be a new grad, which was during the 2020 COVID. I graduated in May of 2020. So when I was a new grad, I basically was a COVID nurse pretty much for a year and a half. And it was very, very difficult. Like imposter syndrome was very, very real for me. I did not feel like I was a nurse. And I remember one shift in particular working, still felt like I was a student nurse because I went to one of my fellow nurses and was asking him about what we were doing. And they were like, well, you're their nurse, Kristen. Like, so you make that determination of what you want to do. And it really hit me at that time. Like, yeah, I am that nurse. Like, wow, like, okay, I can do this. But even then I didn't feel like I was there yet, right? Like I felt very unexperienced, and that's very normal. Again, like I told you guys, as a new grad nurse, you don't have that experience yet. You're just getting started. So you have to start somewhere, and it's okay to feel that you're not alone. There are many other people that feel the imposter syndrome. Everyone's been there, done that. Ask any nurse that's been a nurse for 20 years. They're going to tell you in the very beginning, they felt like they weren't good enough, or that, they probably should have been doing something different. And a lot of that, like I mentioned, guys, is inexperience. It's just, you don't have that experience yet. You don't feel that confidence yet, like that you can fulfill that role. So just know, number one, it's normal. We've all been there. We've all done that. So don't feel like you're the only one out there that feels this way, because you're not. Every nurse out there has gone through this. So don't feel like you're the only one. Second tip I'm going to give you guys for imposter syndrome is making sure you guys are seeking support. It can be very, very challenging, especially as a new grad, when you are in nursing, to feel that you're alone and feeling like you don't know what you're doing. Seeking the right support is very, very important, whether it's another nursing student. I mean, even another nursing student that you went to school with that's working and is going through exactly what you're going through, right? So they're going to be feeling that imposter syndrome as well. So it's even talking to them, seeing how they're doing, how they're coping, what are they doing to kind of help themselves and bettering themselves, learning during their shifts. So seeking that support from a fellow nursing student, seeking the support from your colleagues, other nurses on your unit is actually a really, really, really good source. especially if they've been the nurse for 2+ years, 5+ years, 20+ years, right? You're going to gain so much experience and knowledge from these nurses. Ask them what they went through. How was it for them when they first came a new grad and were dealing with the imposter syndrome? And how did they get over it? What worked for them? Definitely seeking their advice, seeing what they tell you. They're going to know anything better than anyone out there. And again, because we've all been there. So getting that support from other nurses, so nursing students that you went to school with, having a mentor, maybe a nursing mentor. I do a lot of mentoring for some nursing students. I love it because I wish I had it whenever I was in nursing school in general. It's a good thing to have someone to talk to, just someone to listen. You know, you can talk about a shift you went through that was maybe one of your worst shifts as a brand new nurse, new grad, right? You're just learning, you're just trying to get the ropes and you're inexperienced. So you're just trying to get the flow of how things are going to be. Having a mentor can be any sort of nursing mentor, anyone that you can have that can just be someone to talk to, that can listen to what you're going through. And in particular, probably maybe another nurse, because they would obviously be very understanding of exactly what you're going through. You can always have a family member. You can always have a friend. Anyone that's really close to you that you can confide in, that you can talk to is always great too. Yeah, they may not be a nurse. They may not know exactly what you're talking about, but I feel like having that support from someone that can at least listen and be just someone that can listen, that you can just tell everything to, is super helpful. So having that support is so important. So I highly recommend finding a fellow nurse that's been there, done that, having a mentor, nursing mentor. You guys know you guys can always DM me. You can write me. You can email me. You can do whatever. You guys know where you guys can reach me. You can always let me know if you need anything. I would be more than happy to be supportive. Friends, family, other colleagues, other nurses on the unit, family, friends, counsel, anything. Support is super important, especially when you're feeling like you're going through this. And like I said in the very first thing, it's normal. Okay. So get that support that you need. See how people have gone through it when they were a new grad. Third thing, I always tell people, especially when you're a new nurse, you're going to make mistakes. That's human nature, and we're all humans. And even as a expert nurse or a very experienced nurse that's been a nurse for 20+ years, we're human. We make mistakes. But as a new grad, I want you guys to really, and especially when you're feeling that imposter syndrome, like you don't belong, you're very inexperienced, you don't feel like you know what you're doing. By the way, that's very normal. You're going to feel like you don't necessarily know what you're doing. Everyone's felt that way too. But when you do have those little successes, big successes, little successes, I mean, just little things like just charting something off on an Epic or Cerner and finding your way in the system, or having done your first IV by yourself, right? Like on your first patient as a nurse, not a nursing student, but as an actual nurse, right? Having that first IV. I want you guys to celebrate every little success you have, because that definitely helps when you have that imposter syndrome and you're like dealing with trying to get over that and feel like you're a true nurse and you're not a fraud. Having those little successes, celebrate those, like really celebrate those and be like, man, I did my first Foley, or I called and talked to this doctor and I got orders and I got it in and I did everything perfect, or just any skill that you're doing or anything on charting or teamwork and feeling like you were being a team player. Any, as big as it may be, with getting that IV or Foley or anything like that, or just successes of maybe catching something on a patient, of like little signs of like deterioration or something in a patient, or just anything that is as big or small. Celebrate those successes. Celebrate them. They are a good thing. They are happy thing. They make you feel good that you are doing something that's worthwhile, and that you do belong there, and that you are that perfect nurse, and that you're doing the best that you can. And a lot of it is going to be experience. It's going to be practicing those skills. It's going to be seeing what other people do, right? So that's actually another really good thing that I want to tell you guys about too, is you're going to always be learning. Okay. So another thing is, and that's even just as an expert nurse or a more experienced nurse, or someone that's been a nurse or in the healthcare field for 5+ years of nursing experience, we learn every single day. Every single day you're learning something new. There's always new medical studies that are coming out of better ways to treat certain diseases and stuff. And there's going to be newer protocols. You're always going to be learning. There's always going to be a new medication that's going to be on the market, right? You're going to have those reps coming in telling you about a new heart medication. We're always learning. But as a new grad in particular, you're learning even more so than everyone because you're still trying to learn the foundation of being a nurse, of exactly kind of your workflow, exactly how you're going to prioritize your patients, the medications you're giving your patients, why you're giving the medications, how to get these orders from the physician, how to talk to physicians, you learn at such an exponential rate. And I tell this to people, especially from my own experience whenever I was a new grad and it was during COVID time. So of course I had to learn on the fly. Unfortunately for myself, it was really, really hard to really turn to a lot of my coworkers just because nobody knew how to treat COVID at the time. We were learning every day about a different protocol. Every day it seemed like we were giving a different med or adding a med or proning patients when we started learning that this was really helping patients, or it was different. And every time I wasn't sure about what I was supposed to be doing with my patient, unfortunately, none of the other nurses knew what was working, what wasn't working. They pretty much were like, Kristen, whatever you think is going to work, you do you. So I felt like learning for myself. I felt like the first year, especially as a new grad, I felt like I was a nurse for 3 years because I felt like my learning curve exponentially grew just because I had to learn, right? I had to learn on my own and use my critical thinking and really try to hone in on everything. And it can be hard. And that's why I mentioned about making sure you guys have that support. Bounce some ideas off of other people, talk to other nurses and how they dealt with stuff. It is important to have that support, but you're always going to be learning. As a new grad, you're going to be learning every single day. You're going to be learning and constantly learning. And that's a good thing. Because especially in the beginning when you're brand new and you're just trying to get your feet wet and trying to hone in on your skills and everything else, you're going to get a groove. You're going to kind of get an idea of how things are going to work or how your day is going to work or your night, especially if you're like a night shift nurse like I was. You're going to get an idea of how all that's going to be. But just know, learning, keep wanting to be that person, especially if it's a skill you haven't seen done or you hadn't done yet and there's another nurse on your unit that's going to be doing it for a patient. Ask them if you can do it. And then they can be there and help you so that you can learn, you can do it, you can practice. That is very important. Try to get as much experience as you can. So, and just like kind of like when you were a nursing student, actually, it's kind of the same way. So if you got to see a skill or maybe just listen in on something, see anything, right? Just to get that learning experience while you see it. Same thing as a nurse. So if you want to do it, do it. Make sure you guys take as much time to learn and execute a lot of these skills if you're able to. It's very important. So learning, very important. Another thing with imposter syndrome, another tip I'm going to give you, very, very important, and I've learned this over the last 2.5 years as a nurse now, self-care. Self-care is huge. You have to take time to make sure that you guys are making yourself a priority. So whether that's, every evening it's reading, it's taking a nice relaxing bubble bath, or maybe it's watching Netflix, maybe it's meditating, yoga, a facial, going out and having, happy hour with your girlfriends, or spending time with a loved one, boyfriend, husband, kids, family time. Whatever self-care is for you, whatever your outlet is that's going to help you de-stress, because it's going to be very stressful when you're a new grad and you're working and you're just trying to get your feet wet, you're trying to learn, you're trying to do all of the things. It's a lot. It can be very, very stressful, and especially when you have a really hard shift and it was very difficult and it just drains you to the nth degree and you're feeling that imposter syndrome like crazy. Like, I don't know if I'm even here to do this. I don't know if I'm smart enough. I feel like I'm acting like I'm being a nurse and I shouldn't be a nurse. Like imposter syndrome setting in like high, right? Self-care. Just make sure you guys are taking care of yourself. Make sure when you're working, hydrate. Make sure you guys are constantly, make sure you have snacks. Make sure you're resting in between, getting your breaks. I know that's a big thing in a lot of hospital systems too, is making sure you're having your breaks. But in general, make sure you're taking care of yourself while you're on shift or whether you're at home. So just make sure you're taking time to make sure you're prioritizing yourself, distressing. That is important. I can't emphasize that enough. And that's something I've definitely practiced myself, and it helps tremendously. So just make sure you guys are keeping that into practice. One of the last things I want to emphasize as far as when it comes to imposter syndrome is just making sure also you're focusing on a lot of your strengths. So that helps a lot with overcoming imposter syndrome. So maybe you're like the expert on IVs on your unit, right? So like everyone's going to want to go to you for doing those IVs before they have to rely on, doing it through an ultrasound. So maybe if that is like a strength of yours, really hone on that. And that will just be like, that will just pump you up and make you feel better that like, yeah, I am the IV queen on my unit and I can do that, or, doing a Foley or doing, whatever, like just any of your strengths that you find that you are really, really good at. And it could even be like customer service. It could be, you're really good communicating with patients, especially when they're upset, or, talking with family members, or maybe you're really good with the physicians or any kind of nursing skill, or, maybe you're an expert at knowing exactly everything about the Epic or the Cerner system, especially if you were like a tech before or anything like that. And you could be of help to anyone else with where to find things or where to document things or anything like that. Hone in on a lot of your successes, because that will definitely help pump up your confidence and pump up you knowing that like, I can do this. And like I mentioned, it's going to take time. It's going to take experience. It's going to take time to get adjusted to being in this new role as a nurse. So like I mentioned, the very first thing is that this is very normal. We've all been there. We've all done that. Everyone's going to be on a different path too, as far as how long it'll take to kind of get over that imposter syndrome too. Some, it may not take very long. Some, it might take longer than others. But like I mentioned, we have all been there. We've all done that. I just want to make sure to celebrate your successes, make sure that you have that support, make sure you guys keep taking care of yourself, making yourself a priority. So, so important. Hone in on your skills, anything that you can practice. If you can learn, be a sponge. Literally, as a new grad, guys, be a sponge. Be that person that wants to go and learn it all, right? It's going to help build your confidence over time, that you're going to feel a lot more comfortable doing skills. You're going to feel a lot more comfortable with the charting and being able to communicate with like all of the other healthcare providers and the team, right, for your patients every time at the hospital. And then just making sure, celebrate all your successes, and then focusing on all your strengths. It's very, very important for all of this stuff with imposter syndrome. And I promise you, it will get better. And then you are going to be that confident nurse, and you're going to go to work every day, and you're going to feel so much more confident and so much more feeling like you belong, and like, I am a nurse now. Like I am going to be a rock star today. And then you can help other new grads down the road, right? So eventually you're going to be that nurse that's been a nurse for 2 years, 3 years down the road. And then you can be of the help to those other nurses that are new grads and are going through the imposter syndrome. And then you can be of that support. And then you can help them in exactly what you did here or what you learned here that helped you. So I really hope that this episode resonates with you guys, and that you guys take this into practice, and then let me know how you guys are doing and what works for you. Or if you have any other ideas, you guys can always DM me. You guys can comment. You guys can get into my email me if there's anything else that you guys do that you found that has helped. By all means, let me know. But I hope this helps you guys out. I hope these 6 steps, these 6 tips are going to help you. But again, just want you guys to know it's normal. And I hope that soon you're going to get over it. You're going to be super, super confident, and you're going to be an amazing, amazing nurse. I promise. I promise. I promise. I promise. So again, thanks you guys for tuning in to this video, and you guys will catch me next week with another amazing topic. So stay tuned. Thanks, guys.